Hormonal imbalance in men, symptoms, cause and treatment. Men can also be prone to hormonal imbalances. Acne, weight gain, sweating, baldness. What are the symptoms? The causes? Effective treatments? Definition. What is a hormonal imbalance in men? The primary male hormonal imbalance is called hypogonadism. It is characterized by a testosterone deficiency associated with symptoms, with or without a decrease in sperm production. Hypogonadism can be congenital, present from birth or acquired. This hypogonadism can be peripheral, i.e. linked to an anomaly in the production of testosterone in the testicles, or central and result from a disorder of the hypothalamic pituitary axis, says Professor Florence Boitrelle, andrologist biologist at the University Hospital of Poissy Saint-Germain and Laye. Rarely, the man can suffer from an excess of testosterone, but it is generally due to an excessive synthetic testosterone supplementation, practiced by certain sportsmen for their anabolic role. In this case, the production of spermatozoa can also be impacted because testosterone then has almost contraceptive effects, adds the specialist. What symptoms? Let us first note that in healthy men, the production of testosterone is at its highest level in adolescence and young adulthood, and that it decreases by about 1% per year from the age of 30. The symptomatology of hypogonadism depends on the age of the subject who suffers from it. In children, testosterone deficiency is usually detected only at the time of delayed puberty, of which it is the main symptom. In adults, when it started in childhood, symptoms can be poor muscle development, high tone of voice, abnormally small penis and testicles, low pubic hair and almost no hair on the rest of the body, and of course fertility disorders. In adults, when it started in adulthood, symptoms can be decreased libido, decreased fertility, erectile dysfunction, sleep disturbances, mood disorders, depression, anger. This is called DALA. It is an age-related androgen deficiency and not a real hypogonadism, explains Professor Boitrelle. What are the causes? Causes of congenital hypogonadism. The main cause is Klinefelter syndrome. This rare genetic anomaly affects 1 man out of 500 to 1,000 births and is characterized by the presence of an additional X-sex chromosome, 47 chromosomes, therefore karyotype 47, XXY. Affected men may have delayed puberty, small testicles, but some men are not diagnosed until adulthood when they consult for fertility disorders, explains the biologist. Causes of acquired hypogonadism. Peripheral causes. Testicular. Certain chemotherapies or radiotherapy of the testicular region can induce hypogonadism by toxicity on the testicular cells producing testosterone. Certain chemotherapy and/or radiotherapy can induce testicular failure. Other causes: inability of the anterior pituitary gland to produce enough FSH and LH. Hypogonadotropic hypogonadism. Central cause, most commonly pituitary adenoma. Drug treatment. Hyperprolactinemia can be of drug origin. Hypothalamic pituitary tumors. A moderately high prolactin level may be the sign of a hypothalamic pituitary tumor compressing the pituitary stalk. Anorexia nervosa. Aging can induce a drop in testosterone. This is called age-related androgen deficiency, ADLA. This is not hypogonadism in the strict sense of the term, but a lack of testosterone. Diagnostic. In the presence of symptoms and in case of doubt, the attending physician can carry out an initial clinical examination and refer the patient to a specialist urologist, andrologist, who will be able to make the diagnosis and prescribe an appropriate treatment. The first prescribed examinations are measurement of follicle-stimulating hormone FSH levels, measurement of luteinizing hormone LH levels, measurement of testosterone levels. If testosterone is low and pituitary hormones are high, the cause is peripheral testicular. If testosterone is low and pituitary hormones are low, a central cause must be sought, hypothalamus pituitary gland, explains the specialist. Semen analysis is prescribed for men prone to fertility problems. Treatments. What to do to treat a hormonal imbalance? Two main types of treatment exist in case of proven hypogonadism: substitution treatment with testosterone, in the event of congenital hypogonadism, and in young men 15 years old who show no signs of puberty. Gonadotropin replacement therapy, for the return of fertility. Natural remedies? Natural treatments can be considered in addition. Zinc, by inhibiting the conversion of testosterone into estrogen. Zinc helps to optimize testosterone levels. Phytotherapeutic. Plants known to regulate testosterone deficits, without side effects. The most often prescribed is Serenoa repens 320 mg per day, which would slow down the conversion of testosterone into DHT, a metabolite of testosterone. What to eat? If diet is not enough to resolve real hormonal disorders in humans, eating a balanced diet and limiting overweight are essential for proper hormonal functioning and health in general. Certain micronutrients would facilitate the production of testosterone, arachidonic acid, which is found in avocados, olive oil and almonds. Vitamin D, present in fatty fish, salmon, mackerel, sardines, etc. Zinc, found in seafood, spinach or liver. Magnesium, contained in legumes, lentils, split peas, etc., cocoa, certain mineral waters, pepper. Finally, we must not forget that being overweight is one of the causes of low